The doors of West Springs Hospital could close in less than 2 weeks. So is any more help from the state or Rocky Mountain Health Plans on the horizon?
Our Michael Logerwell joins us in the studio with the latest. Michael?
Josephine, Bernie, I found out what support has been offered from the state so far and what could happen if nothing comes through for the only behavioral health hospital between Denver and Salt Lake.
If just 10 a week were referred here instead, solves the problem.
CEO of West Springs Hospital, John Sheehan, told me the solution to save West Springs is simple.
10 more Medicaid admissions a week.
Sheehan says that would keep West Springs Hospital afloat. I asked the Colorado Department of Healthcare Policy and Financing, known as HCPF, if allocating West Springs Hospital an extra 10 patients a week is a solution the state is thinking about, or if it's even possible. But state officials say Medicaid and its regional accountable entity partners, or RAEs, do not allocate patients to providers. Medicaid requires RAEs to build broad-based behavioral health networks all across the state. And they say patients, family members, referring healthcare providers, and first responders decide the best placement for each patient based on their needs. HCPF said if West Springs wants more patients, they can make it easier for referring providers and others like first responders to admit patients to their facility. But if the state says adding 10 more Medicaid patients a week isn't possible, then what solutions have been offered? The state says they've offered support by issuing West Springs a conditional license, working with Rocky Mountain Health Plans to provide millions of dollars in advance payments, by contracting for $4.89 million of services through the Behavioral Health Administration, and through frequent communication with West Springs. But in a letter to state representatives, West Springs officials contend the hospital received no extra financial support. It also says the state-issued conditional license actually cost the hospital money. West Springs officials did confirm to me over the phone the hospital did receive more than $20 million from Rocky Mountain Health Plans in the fiscal year 2023-24 as a part of their regular contract. They also confirmed they have a contract with BHA. So what will happen on June 1st?
So we would have to lay off all the employees. That's 220 employees. That would be closing 48 inpatient psychiatric beds and in particular 16 children's beds, which are critical for any community.
The hospital would shut its doors and pivot to community-based care.
My job as CEO will be to transition us to a model that is sustainable for our ambulatory, non-hospital-based services.
Now, in my conversations with the state, I asked why a hypothetical one-time $20 million infusion, which would cover more than the $18 million West Springs Hospital says it spent to comply with state oversight, fixed the problem. Well, in the letter to state lawmakers, state agencies said, quote, a one-time cash infusion would not address the structural issues that have resulted in West Springs Hospital's recent financial challenges, nor would it put the hospital on a stable path to serve the needs of the community in the years to come, end quote. Now, when I asked the state what they meant by this, they told me, quote, the local community has met to identify pathways towards West Springs Hospital's sustainability. The state is collaboratively engaged in this productive effort. Now, we did attempt to speak to Rocky Mountain Health Plans through their parent company, United Healthcare, but received no response. Bernie, Josephine.
Thank you, Michael.